Dr. Ricketts, can you help me make it through? Dr. Ricketts, can you teach me something new?
Doc On JOX, Dr. Mark Ricketts. How you doing, man?
I'm doing fabulous. How's everybody doing?
Awesome, Doc.
Wonderful. We will get to the phone calls at 741-9450 with the Doc in a moment, also on Twitter as well. Before we talk about our main topic today, as we always do before the phones, I do want to talk to you a little bit about NFL coaches.
Sure.
With John Fox with a heart issue.
Absolutely.
And then Gary Kubiak, who we don't know if he had a mild stroke. He's still being tested and all that in Houston hospitals, but he drops at halftime,
Yes.
leaving the field. We were talking to Herm Edwards last segment about how stressful the job is. Stress can do horrible things to your body, right?
We can break it down. First of all, Coach Fox, the medical staff, I have no knowledge, but I know had to know this about his aortic valve. He more than likely had what's known as a bicuspid aortic valve, where you have two leaflets instead of three. Arnold Schwarzenegger, that's what he had. And when you start having chest pain or you feel like you're going to pass out, that's the time when you want to go ahead and operate on folks. My guess, and I'll put money on it with Gary Kubiak, he either jacked his blood pressure up from stress that it caused him to have a mild abnormal heart rhythm called atrial fibrillation that would have made him get weak like that and would have potentially thrown blood clots off to his heart, which would have caused the stroke. That was my guess when that happened during the game the other day, that's what had happened. And that's from his blood pressure being up so high.
And stress can cause that?
Oh, absolutely. And, these guys, they're wound tight all the time anyway, and they also try to be the men of steel that they pretend that nothing is wrong with them. And, even though you're used to thinking of these guys, you look at Gary Kubiak, I mean, God, he looks great, health-wise and stuff. But you can get snake bit, and you just got to be always alert. That's why I say paranoia will keep you alive.
Now, the Doc on JOX every week has a big topic he likes to talk about. Today, it's type 2 diabetes and the dangers of that. So a lot of people dealing with that who's listening to us right now. So before we get to the phones, let's talk about type 2 diabetes.
I know this so well, I'm even going to turn my paper over because I am a type 2 diabetic. And this was a hot topic, but it's a common time of the year. What I want to do is talk about signs, symptoms, and things to look out for. Type 2 diabetes, or adult onset, it's kind of a misnomer, adult onset diabetes. It can start anywhere from about age 19 or 20 on through adulthood. And there are certain times that it is more likely to occur, particularly after age 45. I was 47 when I came down with this. Type 1 diabetes, which our wives deal with, Brownie, is where your body actually quits making insulin and you have to have an insulin pump, and that will be actually begin for a lot of folks in childhood.
And it's called juvenile diabetes, though my wife wasn't diagnosed until into her 20s.
Yeah, we're getting away from the juvenile and adult onset stuff.
Right.
It's type 1 and type 2.
Because those are very misleading names.
And they're very different diseases.
Right.
Type 2 diabetes is a problem with your metabolism, and that's where your blood sugar, you become intolerant to carbohydrates, which are basically, we talk about starches and stuff. Well, that's broken down into sugar, or a type of sugar called glucose, that your body uses to do everything power function-wise inside your cells. It's broken down in this little organ called the mitochondria. You have to have insulin to bring the sugar in the cells for them to burn. What tends to happen with folks with type 2 diabetes is they become resistant to that insulin for whatever reason. If you become obese, which obesity is a real cause for this problem, you actually produce a hormone that's much like cortisone, or a stress hormone that your adrenal glands produce, that will bind to those receptor sites and cause you to become resistant to your own insulin. It will also trigger off the beta islet cells in your pancreas. It's a little fish-like organ in the middle of your abdomen. It produces your insulin to actually produce more insulin. So it's not uncommon for folks that eat something real sugary that have this, to have that sugar drop out and actually have hypoglycemic events before they ever develop full-fledged type 2 diabetes mellitus. Now, things you've got to worry about with this takes a tremendous toll on the inside of the blood vessels of your body. And that's where you want to focus on. Everything danger-wise with this is associated with the damage to the endothelium, or the inner layer of the arteries throughout your body. It'll cause you, if your sugars stay too high, it'll cause cholesterol deposition in those arteries. It can lead to heart attacks. It's one of your leading causes of heart attacks. It can lead to blindness. And it can affect the retinal arteries in the back of the eye. It can affect your kidneys. Your kidneys are basically two small football-shaped large groupings of blood vessels, and it will totally destroy those, and is involved in diabetes a lot of times first off on causing damage to that area. It can affect the arteries supplying blood flow to the nerves in your legs, cause you to have claudication or peripheral artery disease. You see commercials about that. But before it does that, it affects the small arteries that go to the nerves in the feet and the legs, and it can cause you to have this painful condition known as peripheral neuropathy, where you get this burning, stinging type pain all the time. We harp on type 2 diabetes because it is there is a genetic component to it. Most folks do have a family history. I had it on both sides of my family, so I was pretty much doomed. But I would have been on cortisone for another medical condition that exposed mine and brought it up, and it also caused me to gain about 60 pounds. So that weight gain with a lot of this is a lifestyle issue. Not every type 2 is a fat person. They're not. Or an obese person, whatever's politically correct. But I almost call fat because I was fat. And I'd become resistant to my own insulin. And, the day I found that I had it, my blood sugar was over 600. I was seeing patients.
Over 600?
Over 600.
I mean, you were almost in a coma.
Dude, I felt great.
Really?
Yeah, my brain, I felt great. I couldn't see real well.
I was about to say it had to affect your vision.
Affected my vision, which it'll do it because the sugar gets caught up in the eyes and you'll distort the eyes and you'll think, I thought I was going to get a new flat screen TV out of this because I didn't have a flat screen TV at the time.
So what did you think? What do you think was wrong with the eyes?
It was when you deposit your sugar acts like a diuretic and it'll pull so much fluid out of you, but the sugar gets stuck in the lens of the eye, so it will distort the lens of the eye so you can see off. Like I could see the TVs and I can see Harry over here really well.
Yeah, but didn't you realize something was wrong with yourself?
I just thought, no. But denial's a powerful weapon, dude. I mean, it is a powerful, powerful weapon. So those are all things you can do, but we know if there's tons of medications. The first thing we're going to do is diet and exercise, get your weight down, control your carbohydrate intake. There's tons of medications that we can use, and sometimes, yes, we do have to use insulin. But if we have to use insulin, it doesn't mean that you're going to be stuck on it from now on. There is a key blood test we do known as a hemoglobin A1C that we do every 3 months. And if you can keep that number at 7 and below, which is a daily average of 140, you can prevent all these things we talked about from actually occurring. And that's the beauty of it. We have a metric that's over 20 years old that we know actually works.
It's almost like a golf handicap, right?
It is exactly like a golf handicap, and that's why we have to make it come in every 3 months. We do that. We monitor the bad cholesterol levels. We monitor how you're putting out proteins out of your urine. All that can be fixed and taken care of. And with dealing with your doctor, medication, self-monitoring, get up off the couch, get rid of that sedentary lifestyle, even with the PS4 and the new Xbox and coming out. Get out and do something during halftime. Watching that diet, you can prevent so many, if not all, of those complications we talked about before and make your risk barely, if not greater, than the average person out there that doesn't have it. It's estimated that 1 in 5 Alabamians has type 2 diabetes. And that's why we spend so much time focusing on that, because if you focus on that, you can attack so many other things you can fix that will prevent heart attacks and strokes and losing limbs. And I think I've only had one person lose a limb in probably the last 10 or 15 years because of our testing and the improvement in medications and stuff. So that's type 2 diabetes sort of in a nutshell. We'll have a lot more on the website about it.
Listen, now, good information there. Phone calls now, 741-9450, 1-800-239-9569. Let's go to Leslie in Montgomery up first. Hey, Leslie, how you doing?
Hey, guys. First things first, Doc. Your segment is my second favorite, second only to Trash on the Table every day.
Well, you're a smart man, because that's how I'd rank it, particularly Trash on the Table. I love it and Herm, so those are my two favorites.
We appreciate the info you put out. Look, Doc, I've got a question. To set the story straight, I have a history of Chiari malformation in my family. My sister underwent surgery 7 or 8 years ago to correct that.
Yes, sir.
I have dealt with, since a youngster, with headaches.
Yes.
And my doctor here in Montgomery, Dr. Graves, had told me that I needed to keep a headache diary.
Yes.
And I've done that, and most recently what I've found, they're usually like tension headaches at the base of my skull and in my temples.
Yes.
When I have those headaches, I notice a noise when I move my head side to side.
You bet.
Sounds like gravel in my neck.
You got it. Well, let me help you. Let me start off and explain to our audience, first of all, what Budd-Chiari syndrome malformation is. Bud-Chiari malformation is when the opening at the base of the skull, known as the foramen magnum, where your brain begins the spinal cord, is actually too small. And you can turn your head in certain different directions, and it'll set off intense headaches. I mean, it almost blinding migraine-type headaches in individuals. It can also lead to strokes by involving the two arteries that come up the neck that supply blood to the base of the brain, known as the vertebral arteries. And it does run in families. We know it is. We're pretty certain it's an autosomal recessive disease. That is, you'll see it if you get the right combination of those genes. There's a ton of it in Alabama. It can be surgically repaired, fixed. Dr. Mark Hadley at UAB, dear friend, and does a wonderful job with fixing that. Now, in your case, here's what I would expect that's going on. You probably have arthritis in what are known as the pedicles or the wing bones that come off the neck. And a lot of times you'll see that with folks who also have Budd-Chiari syndrome. And if those muscles tighten or that lubrication there begins to wear out or you strain those muscles, you will have an intense muscular type headache like you're having when you turn your neck. That's just bone on bone. That's that gravel that you're hearing there. What we want to do in those cases, first of all, is get it properly diagnosed. And Dr. Graves, by the way, is an outstanding doctor. Dealt with Dr. Graves when I was with the 908th Airlift Wing down in Montgomery all those years and just does a super job down there. Keeping that diary is real important because you can look for triggers and you look for events that are going to cause that to happen and try to figure out what's causing that headache. But non-steroidals and muscle relaxers and physical therapy, they're good. If you have a really good acupuncturist in the area, and there are a lot of really good folks here in the area, acupuncture can also be really good there too. But building up those muscles to support those wing bones, being on a good non-steroidal drug to cut down inflammation, and being on a muscle relaxant and some other agents when this occurs, we can make you a lot better. I promise you. And Dr. Graves is your person to get it done down there.
Well, I appreciate it, Doc, and I'm due to see him in a couple of weeks, so I'll make sure to pass on what you've said and ask him a few more questions about the information you gave me.
Well, you're doing a wonderful job, and God bless you, and hope you get better real soon.
Thanks, sir.
Leslie, thank you. More phone calls coming up. 12:21, jam-packed on the phones. Let's see how many we can get on. Scholar Athlete of the Week. First, though, from the Doc on JOX.
Yes, sir. It's Mr. Daniel. Thank you. Mr. Daniel Meharry from Homewood High School. Daniel's a football and baseball player, has a 3.57 GPA, made 25 on the ACT, played fullback and linebacker for the football team, pitches and plays first and third base on the varsity baseball team, as you should, young man. He's not certain where he's going to college yet. He's going to go into engineering. Sounds like an Auburn guy to me, or a UAH guy. Hopes to play baseball in college, definitely UAH. His favorite topic's physics because it explains how things work in the world every day. He's a very logical guy. Favorite folks on his iPad or iPod are the Lumineers and Luke Bryant. So congratulations, Mr. Daniel Meharry, as our Scholar Athlete of the Week.
All right. Art in Lincoln is up next with us. Hey, Art, how are you?
All right. I sure appreciate y'all taking my call.
Sure.
Try to listen as much as I can. Doc, you having a pretty good day today?
Well, Art, we doing all right. How about y'all? Thanks for asking. Nobody ever asked me that.
Yeah. I got a question for you. I never really hear y'all talk about this. Peyronie's disease.
Let's talk about it.
What is the final outcome? I have had it for several years. I've done the treatment with the medication and with exercising and around the shots. And they're telling me now my last thing to do what I need to do is a surgery.
Yes.
Have they got anything else coming out that might couldn't do anything to curb not having to do the surgery?
Let me answer that quick. No. Okay. I mean, I hate to say it, but now there are some excellent, one guy particularly, Dr. Brian Christine, that comes on our station a lot, who's out at Medical Center East, or St. Vincent's East, is outstanding. He's one of the country's best at doing that particular operation. But unfortunately, when you get to that point, the shots aren't working and other medications and all that aren't working. But if you want to straighten things out,
right,
that's really what you got to do. But the surgery's great. It's a quick recovery time, and it is very, very successful.
Well, as a matter of fact, being you said that Dr. Christine is my doctor I use. I'm just, you never hear anything said about it, and I just wondered, and I know it's probably other, men out there.
There's tons of guys out there doing it, Art, you bet. There's lots of guys that have gone through it. But, yeah, listen, Dr. Christine, if it's me, that's where I'm going to be. Because, him or my buddy Dr. Patrick Mills out in Pelham, those guys are just the best. So, and they're great at doing this. But Brian has dedicated his career to dealing with these kind of issues. And let me tell you, if he's saying do it, then he's done everything he can do.
Right. Yeah, I've been seeing him ever since the medication round quit working, and we started to exercise, and then like I said, I've done the whole round of shot thing. And
well, sound like we're there, Art. So just put your trust in Dr. Christine. I know he's going to take really good care of you, and he's going to get this fixed.
Okay, thank you, Doc.
Take care, bud.
Nice day.
All right, Danny in Birmingham next with the Doc on Jocks. Hey, Danny.
Hey, a first-time caller, and I enjoy your show. I listen to it quite often as I'm driving down the road. I'm in sales. And I just had a couple of questions for the doc. I am 56 years old, and I got diagnosed about 2 years ago. My testosterone level was just bottomed out.
Yes, sir.
And so I started going, and my regular medical doctor has given me shots, and that wasn't doing what I needed, and so she gave me the prescription for androgel.
Yes.
And it's totally changed my life and made me feel better. But now I'm in the middle of a job change, and I've got 2 months without insurance, so I can't get the androgel. And I'm trying to figure out what I need to do because I know the shot just doesn't provide everything I need. My T level's so low.
Well, that's a tough one because I tell you what, normally it's the exact opposite. Now, I prefer the gels right up front. Now, there are implantable pellets that individuals can do, but I would say steer clear of those for right now just for reasons I'd rather not go into on the air.
Okay,
It's unusual that the shots haven't worked, and that's certainly going to cost you about a third of what the gels are going to cost. It may be better than nothing and have to be adjusted a little bit differently the way they're doing them or where they're giving them to you or how often they're giving them to you. You may actually have to do the injection weekly, given the fact that how much trouble you had rather than doing it every 2 weeks.
Well, is there something else that I could get in a gel that's not going to cost a fortune? Because
No.
I had the program on the androgel. It was
Yes.
$10 with my insurance, and now all of a sudden I can't get it.
Well, it's the oldest of the gels, and it'll be the one that'll go off patent first. But no, listen, they're all about $300 to $400 a month, which is ridiculous. But Testamaxeron, all of them are about the same. You know, I'm thinking about this, but let me. Well, I tell you what, I'll do some more homework. I think somebody's doing some compounding with the testosterone here in town locally, and let me look at that, and maybe we'll bring that up on the air next week. How about that?
Well, my regular druggist is a local druggist in Pinson, and he said that he could do some compounding if my doctor would write a prescription, and that's where I've had trouble getting if you don't go in there, you can't get anything done.
Now, you're going to have to spend that copay now to go in there and get him to do it. But I do it because now it's not going to be perfect, but it'll save you a lot of money, and it does work for a lot of guys.
Okay, I got one more quick question because I know you got a lot of people that are interested. Obviously, I had my blood work done about 3 months ago, and my doctor did not want to put me back on medication. My triglycerides were out of shape. You know,
Yes.
Get off the sugar, get some back on bottled water, and I tried to cut back on anything sweet and fried and all that. But is that something sugar? Is sugar part of triglycerides?
Oh, you betcha.
Does that lead to the diabetes? I've got a sister that I've never been, diagnosed with it, but when I went in, my doctor said, you've got to get off this stuff. Your triglycerides are so high that I can't even tell you what the number is. She said, I'm going to put you back on medication if you don't get it back. And I've lost about 10 pounds over the last 3 months trying to cut back on things.
Yes, a lot of folks, when you have elevated triglyceride, that can be an isolated level that you are having spikes in your blood sugar along the way. Probably a good idea for the doc to measure your insulin panel and also do a hemoglobin A1C on you. Let's see for certain, and we'll get more on the sugar control and bring those triglycerides down.
One more, Ronnie in Odenville, who's been very patient with us. Ronnie, how you doing?
I'm good. How are y'all?
Great.
I was going to tell you, I love y'all's show. I listen to it every day. I just come out here and sit in the truck and listen to it.
Good man.
Ironically, that's how we do the show.
Yeah.
We sit in the truck and do it.
Hope you're on the clock. In a Dodge Ram or Laramie. We'll go with the Bighorn.
Yes, sir. Doc, I love listening to you. It's kind of a long story. I'm type 1 diabetic. I've been a diabetic for 33 years. I'm 42 now.
Yes, sir.
Wow. I have also celiac sprue.
Yes, sir.
You know what that is?
Oh, know all about it.
It's got a name. It's about a page long, but I had a car accident about 13 years ago. I had a plate and stuff in my foot.
Yes.
They had to take it out because the joint wore out, and it started wearing. My bones started wearing together, and it took off about a fourth of my heel.
Okay.
This was Dr. Krause.
Yes.
You're familiar with him?
I know him really
They
well.
say he's the best.
He is.
Dr. Chadban is my endocrinologist. I've been seeing him for about 25 years.
Yes.
He said I'm healthy as a horse. He said, I don't know anybody else more healthy, than you are. My A1C is always around 6, 6.3. I mean, it's always good, but I've had 3 surgeries where they've done a bone graft on my foot, trying to get that fourth of my heel to grow back.
Yes.
And they've got me on a nasal spray that's for women. It's for osteoporosis.
Yes.
And I was wondering, is there anything? The bone won't grow. He said it'll grow about a 1/16 of an inch.
Bone stimulator.
And it stops growing. I've got a bone. I've been wearing a bone stimulator for 2 years.
That's when you're doing that, maybe put a little extra pressure and all on it when you try to walk. But that's just a big problem we run into with type 1s as far as getting this stuff to take. Sound like you're doing everything the right way. Krause is on top of it. We're sort of at the end of probably the things we can do for it, but definitely the bone stimulator, definitely that nasal spray, both. And you're in the hands of some great docs there, Dr. Chadban and Dr. Krause. So I'd do whatever they said do, and let's just do what we can, see if we can't get you well.
He said, he said if you want to see another doctor, that's fine. He said, but at this point, there's nothing else, that we can do for you.
Well, I'd have to agree, and if he's telling you that, I'd probably have to agree with him. That is just such a common problem in type 1 diabetics. It's tough.
Right. I didn't know if there was anything else I could take. I take, I don't know, it's a prescribed amount of multivitamins, because...
Best thing you can do personally, keep that sugar under tight control. That's a big thing for you to do right now.
Thanks a lot, Ronnie. Good luck.
Sorry, we're out of time, Ronnie. That's the Doc on Jocks for this week. Always good stuff right there. If you'd like to make